A very good morning to you. What is the turnout in terms of this cohort?
Thank you, Desiree. Good morning to you and, of course, to the viewers. As you have stated there, the vaccine cohort for 12 to 17-year-olds has officially opened. And, of course, you would understand that as of today, this age group is expected to at least show to different vaccine sites to get their COVID-19 vaccine. You have stated there that the Pfizer vaccine, the single dose of Pfizer vaccine, is expected to be administered. And of course, behind me, I am in Unit 9 in Mahikeng. That is one of the vaccination centers. And I can just tell you, Desiree, that behind me are adults who are here really to get different help for different medical reasons. And I have not seen with me any 12-year-old to 17-year-old queuing here, coming to get a vaccine dose. You would know that as different provinces are expected to administer this vaccine dose for this age group, the Department of Health here in the Northwest says they have not just yet received the guidelines from national as to how is this cohort going to unfold, but we understand that no schools have been set as vaccination sites, as these different schools are expected to be writing examinations only. But the Child Act 38 of 2005 has really come in to highlight Section 129, where it says children from 12 years old are able to consent to their medical treatment or any medical help. And of course, this is spewing different debates from adults and from these children also who are saying they would go to vaccinate. My colleague Tumicha Butlelo and I, of course, spoke to different parents and different children, and this is what they had to say on this package, Desiree. The Department of Health's vaccine rollout for children between 12 and 17 intends to vaccinate more than 3 million children by mid-January. The Pfizer vaccine is the only jab that was approved by the South African Health Products Regulatory Authority for use by this age group. These teenagers say they are ready to get the jab.
I'm 14 years old and I want to vaccinate because I don't want to die, and I cannot wait to vaccinate.
I do not want corona to infect me because I saw a lot of people die.
The debate around parents' consent has been fierce. According to the Children's Act 38 of 2005, children older than 12 can get medical attention and treatment without a guardian's consent. Some parents have welcomed the fact that their children will be vaccinated. I have been impatient because our children have been going to school without any vaccine, mixing with different people, some who did not want to vaccinate. I don't have a problem. I have a 14-year-old. I will be taking her to get a vaccine tomorrow after school, while others have reservations. I won't have a problem with my child vaccinating if they tell me they must communicate or at least allow us to sign something. I won't have a problem if they allow me to give consent. The Congress of South African Students, COSAS, has welcomed the initiative on condition that consent will be sought from parents.
We know a person under the age of 18 has no responsibilities. We therefore encourage the Department of Health and the Department of Basic Education hand in hand to at least have engagement or bilateral with the school governing body to consider the consent of parents or guardians before they can proceed to vaccinate learners.
The Department of Health says it will work with the Department of Education to ease the process.
National has indicated that the EVDS needs to be adjusted to accommodate consent for the 12 to 17-year-olds. So the issue of consent is not a big issue, it's not a problem. We also know that we have a responsibility to work with the Department of Education, who are going to link us with the schools. We have been working with the Department of Education with the teacher program. So with the learners as well, it won't be a problem.
The Department of Health says matriculants will be prioritized as they are heading towards their final exam. Tebogo Phakedi, SABC News, Mahikeng.
Well, we're coming out of that clip, and Tebogo, has the Provincial Department of Health given any directive for the vaccine to start for this age group?
Not as yet. We spoke to Tebogo Phakedi, as you saw there, who is the spokesperson of Department of Health here in the province. He said that the National Department of Health has not as yet given them the guidelines as to how this vaccination cohort for the 12 to 17-year-olds is going to unfold. And as you see behind me, no 12-year-olds or up to 17-year-old coming here to vaccinate, but as you saw on that package, some parents willing to take their children to the different vaccination sites, some of them private, some public, to go vaccinate. But as to how this program is going to unfold, has not yet been communicated. And you would understand that some parents quite concerned about the issue of consent, and we saw the Director General of Department of Health speaking earlier on SABC News Channel 404, saying the issue of consent shouldn't really be a train smash, as these children have been consenting to their different medical reasons. Really, he made an example there of abortion, pregnancy, and others, saying they have been consenting for so long. But there seems to be one of the parents here. Thank you so much, Mama. From 12 to 17 years old, but logo vaccinate. Jaka motsadi maikutlo ga go ke eng ka ga seo ebile a o batla ngwana ga go a kope tetla pele bila ka go vaccinate?
Jaka motsadi re tlhoka gore bana ba rona ba kope tetla pele ka ntlha ya gore tota se puso ga re direle sentle. Bana ba 12 years to 17 years ke maikarabelo a rona batsadi mo e leng gore le ga ba tlisiwa ditleliniking ba romelwa mo ditleliniking ba tlhola ba busiwa gore tsamawe go tla le motsadi. Jaanong ke makadiwa ke gore gone yaanong ga re tla mo letlhakoreng la vaccination ga gona le ga ile di consent form dipetse e leng gore di re puso ya dintsha e re jaaka batsadi tlatsang di consent form. And yaanong batsadi ba bantsi on the ground floor batsadi ba bantsi ba utlwile botlhoko ebile ba tshagetse gore bana ba bone ba beiwa at risk ka ntlha gore ba itemogetse mo botsading ba ba setseng ba vaccinate le mo nakong e hitile gona le ba ba nileng di complications. Jaanong ba ipotsa gore ka bana ba bone ga o ne le motsadi o tla bo opiwa ke tlhogo e ne gopa kgotsa letsogo le rurugile mo bane le letsapa le le neng le nna teng go go diragalang ka matshelo a bana mme o le motsadi o sa signa any consent form between the department mme department ga e bone gore e itsenya mo mathateng yone ka bo yone mo go se se dirang.
Jaanong wena jaaka motsadi a utlile go tsa ngwana wa mo isa ko di vaccination site a yo go vaccinate?
Nna go itlhaga jaana ke kare ga ke na ngwana o ka ba sentse ba le ko tlase mme ke na le ba ke nnang le bone ba e leng gore ba godile ke ba bobuti ba ka ba a ke re le bone ba bala ba retsa mo di radio bana ba rona ba open ba re bona ga ba not yet ready to go and vaccinate without the consent of the parent.
Lina ke mang?
Lina la ka ke Matlakala Flaming as a chairperson ya Unit 9 clinic.
All right. Thank you. That is Matlakala Flaming, of course, one of the parents there, saying there that thank you very much, Mama. Saying there that the parents are livid that the Department of Health has not been communicating with them, further stating that she, of course, highlighting the side effects that they experienced as parents when they vaccinated, wondering how is that going to affect the children. Of course, she spoke of the severe headaches she had after vaccinating, and she is saying as much as the Department of Health says these children do not need parents' consent, it is quite surprising because when they come to different clinics here in Mahikeng or even here in the province asking for help, the same children are sent back home to get the parents to consent to whichever medical reasons made them approach the clinic. But these are the views there's on the ground. The parents consent about the consent, and of course at this point no information has been made available as to how this vaccine cohort for the 12 to 17-year-olds is going to unfold. But you heard it there from one of the parents. The issue of consent is still a train smash, and they want the Department of Health and the Department of Education to communicate further with them. But we know that no school thus far has been pointed out as a vaccine site. Department saying this is because there's different exams being prepared for. Therefore, no schools will be used as a vaccine site. We will see when the day unfolds, and of course other days and weeks, whether we will have a number of 12 to 17-year-olds approaching different vaccine sites to get a Pfizer dose to ensure that they protect themselves. Desiree, back to you in studio.
Tebogo, thank you so much for giving us a sense of one of the vaccination sites in the Northwest and how things are progressing there.